Hi students, I am Saidal here. Today we are going to discuss about the association cortex, cerebral asymmetry, cortical plasticity, and cerebrospinal fluid. Let me go to as a one by one. Now I try to make you understand this concept. And first we are going to be see about this what is the association cortex. It is the newest part of the cortex. Actually, in evolution, the part of the brain that has grown maximally is the association cortex. In the division of phylogenetical level, so there is a newest part that we found. It is just called as a neocortex. The association areas of the cortex there is a different from other cortical areas like the sensory or motor cortex. So they are the named association cortex because originally they were thought to be associated with an integration of sensory information from somatosensory cortex and relay the integrated information to the motor cortex. So next we are going to be move to the important point. It is well developed in human. As neocortex is absent in the fish, amphibians, and reptiles, and it is poorly developed in the non-human like this, mammals, but it will be most well developed in human because it's mainly focused on or mainly acts on the intellect, personality, language, speech, learning, and memory. These are the skills which is present in the human only. So maybe that is a reason it which is a well developed in the human. Okay, so next followed by this one we are going to be know about this, what are the areas which is present in the association cortex. So there are the four areas which is mentioned, which I mentioned. There is a prefrontal, parietal, temporal, and limbic association cortex. So in this diagram I have just clearly mentioned. So this is the prefrontal association cortex, and this is a parietal temporal occipital association cortex, and this is a temporal association cortex, and this is a limbic association cortex. Is a prefrontal association cortex consists the rostral part of the cerebral hemisphere in front of the premotor area. So very exactly it will be located in the near to the premotor area. So next we are going to be see the what is a parieto-temporal occipital association cortex. This extends between the somatosensory and visual cortex above the posterior portion of the temporal cortex just below to that one. And next we are going to see this temporal association cortex. This extends from the lower portion of the temporal lobe to the limbic system. And here in the limbic association cortex, the cortical area associated with a limbic system are included in limbic association cortex. So these are the anatomical structure we have to be clearly explained where it is exactly situated. So next we are going to be know about this, what is the feedback control system of neocortex. The association of cortex or the part of the sixth layer of the cortical areas of gray matter that spreads in the cerebral hemisphere. Actually, the connections within the neocortex or the complex network of the neuron, like other cortical areas such as the motor cortex, they are the pyramidal and non-pyramidal cells in the associated cortex. So now we have to know about this one. There is a complex feedback control system within the neocortex, as well as the descending axons of the pyramidal cells send collaterals that projects to via association neurons back towards the dendrite of the cells from which they originate. The forms of the anatomical base of the feedback control. So the dendrites of the cells in the deeper layer receives the input from the thalamus, reticular formation, and other cortical areas. Afferent from the thalamus terminate mainly in the fourth layer of the cortex. And followed by this, we are going to be see the functions. So the human being is more skilled in language and speech and higher cognition function that include the ability of the analyze the situation with proper reasoning and interact with the environment accordingly. So neocortex is highly developed in human to integrate these higher intellectual functions. So association cortex function mainly on this language and speech. So now the function of the language and speech in human, for example, the understanding of the spoken and written words to express the ideas in speech and writing, or the mainly the function of association cortex located in the perisylvian region, or as we used to call as a language areas. Okay, so now we have to know about this one little bit elaborate. However, the language functions depend more on one cerebral hemisphere than on the other. The hemisphere which is concerned with the language is called as a dominant hemisphere, and the other hemisphere is a non-dominant hemisphere. Due to its categorizations in language function, the dominant hemisphere is better referred to as a categorical hemisphere, and non-dominant hemisphere is also known as a representational hemisphere. So I hope you understand. So what is the dominant, which means I better have to be give a good example. So just think about there is a two type of hemisphere. One is a left hemisphere and a right hemisphere. Similarly, there is a dominant hemisphere, another one is a non-dominant hemisphere. So the dominant hemisphere is considered or will be referred as a categorical hemisphere, and as a non-dominant hemisphere is a representational hemisphere. So I hope we have to be clearly understood. It is a dominant hemisphere is a categorical and non-dominant hemisphere is a representational. Okay, because this is most important in the further slides. We have to be induce this one. We have to be just make it more clear. So next we are going to be see the face recognition. These are the other neocortical function. The main function is the language and speech. So these are the face recognition, calculations, and navigation. So these are things is the other neocortical functions. So these are the supporting functions only. So now the recognition of the faces is important function as it is essential for social and emotional interaction. This is the function of the representational hemisphere, which is usually the right hemisphere. Okay, so next we are going to be check that will be mainly responsible for the representational hemisphere. I hope everybody know about this one. It's a representational hemisphere, which means there is a dominant or as a non-dominant. It is a non-dominant hemisphere. Okay. Next, we are going to be see this what is a calculation and as well as a navigation. So, what are the areas responsible for the calculation and navigations? So, here we are going to be see the calculations. There is the two brain regions are involved in arithmetic calculations. So, one is the inferior part of the left frontal lobe, and it be this area concerned with the actual calculations. And second thing, there's areas around the intraparietal sulci of the parietal lobes of the both the sides. So this is area will be responsible for the memorizing the numbers and finger counting. If there is any lesions which is present in this area or in the frontal lobe, so it will just result in is a acalculia, which means the person cannot be able to make the mathematics. So otherwise is impairment of mathematical ability. Okay, next we are going to see this navigation. It is a means sense of direction finding. This is a spatial skills. It is a more developed in the man than in the woman. Okay, now is where exactly be located. It's the right side of the hippocampus, which is concerned with the learning, and the right caudate nucleus, which is concerned with the movement of the or the areas involved in the navigations. Next, we are going to be discuss about the cerebral asymmetry. So otherwise it is called as the cerebral dominance. So now there is a two hemispheres serving discrete function have been they referred to as a cerebral asymmetry, especially the function of the language and speech in human are more localized in one cerebral hemisphere than in the other. So that's why how to be just mentioned here there is a right hemisphere and left hemisphere for clarification, and the hemisphere which is concerned with the language function has traditionally been called as a dominant hemisphere, and opposite one is a non-dominant hemisphere. So one hemisphere is categorized for language function, and that it doesn't mean that dominant hemisphere is a less developed. Due to this categorization of language function, the dominant hemisphere is better referred to as a categorical hemisphere, which means that non-dominant hemispheres are rather focused in function concerned more with the visuo-spatial relations. Here I just mentioned I have to tabulate it here, and there's a dominant hemisphere and there's a non-dominant hemisphere. So the dominant hemisphere is responsible for the language related activities, reading, writing and speaking, and non-dominated is a non-verbal function like is a motor task requiring the orientation of the body in the space, and dominant hemisphere is a complex intellectual functions and requiring verbal, analytic and the computational skills, and here in the non-dominant hemisphere is recognition and the understanding of the musical patterns or non-verbal visual experiences. So these are the things that is a dominant and non-dominant. So how to be is both how to work symmetrically. If anything will be happen, the person is becomes under the cerebral asymmetry. So now we are going to be see much more interesting part, and what is the relation with the handedness. The specialization of the hemisphere is linked to the handedness. For example, how just give the one clarifications and give the examples to easily to understand. So about 90% of the human population are right-handed. So right-handed means they used to write anything in the only in the right hand. So in 96 of the right-handed individuals, the left hemisphere is a categorical or dominant hemisphere. Only 4% right hemisphere is a dominant, which means those who are writing in the right-handed, so there's a left hemisphere is a categorical. So which means the left hemisphere is going to make the dominant. Only is a 4% is a right hemisphere is a dominant. So that is the reason we have to be the cerebral asymmetry, otherwise is called as the cerebral dominance. So in left-handed individual also the left hemisphere is categorical hemisphere, which means a dominant hemisphere is 70%, and right hemisphere is dominant only the 50%, and but we can't be able to know clear lateralization in the rest of 15%. So the ball is stated the left hemisphere is meant for vocalization like as a speech, and right hemisphere for the recognition of the faces. So it has also been observed the language disorders are more common in the left-handers, though they are more talented in the spatial function like the music and art. So depends upon this one. So those are the left-handed. Not we are going to just mention. So it maybe is there is a more common in language disorders or more common in left-handers. So though they are the more talented in the spatial function like as the music and art, used to draw the diagrams on everything. So there is a one more function for the left-handers. Next, we are going to see about this cortical plasticity. So the basic element of the nervous system is the neuron. The neural connections are determined genetically, and once it be established, remain almost throughout the life. However, it is some special circumstance or synaptic connections can be modified in the CNS, especially in the brain. This ability to modify to refer to as a cortical plasticity. So actually it cannot be able to grow, it cannot be able to produce. Actually it may be developed, it maybe is going to be modified in the CNS space, specifically in the brain. So that is called as a plasticity. So it is present in the cortex area, that's why have to be mentioned as a cortical plasticity. Okay, now we have to know about this one is what situation and by what mechanism do the neuron modify, by which time, when, where. So now we have to be clear this one. So synaptic connections can be modified in the CNS. It occurs in the three areas. One is the postnatal, brain injuries and experience. So postnatal, so which means is after the birth. So what will happen? There is a postnatal modifications. So the postnatal modifications of neuronal connectivity occurs as a result of the interaction with the environment. Environmental effects affect development and alteration of many neural connections. So number of synapses increases during the development until maximum level of the gradually reached in the early adulthood. So after that, second thing, there is a brain injury, which means in postnatal we seen about this one is the number of synapses will be increases. Keep on the synapse will be increased after the birth. So that is a one stage. And second stage there is a brain injury. There is a regenerate of the connections in poikilothermic vertebrates and there is a homeothermic vertebrates. So these are the regenerations mainly occurs in the nervous systems. And there is a experience of the synaptic connection may be changes. So the person will be affected by the capacity of the certain neurons to change the behavior as a function of the environmental inputs is a very important property of the nervous systems. So this serves the basis of the learning as well as the adaptive behavior. So for example, the learning is referred to as the process of changes in the behavior as a result of experience, isn't it? So the person wants that is to learn so how to behave. Suppose the person will be opposite person is behaving is going to be opponent. So what will happen? Immediately the concerned person will be just changing the behavior. So next time, which means that is a experience. So in second time or third time is going to be make the modified, is going to make the changes of this in the behavior. So these are things comes under the synaptic connection changes by the experience. And one more example I have to give. There is a memory is a storage of information experience induce a modification. The storage of information involves actual physical changes in neuron. Changes in synaptic connection and cellular changes are the basis of the learning and memory. This is another example of the cortical plasticity. Next, we are going to be see the cerebrospinal fluid. So this is called the CSF, cerebrospinal fluid. So here we are going to be mainly see about this. What is the introduction part? How will be make formation and where it be exactly circulated and what are the absorption, what are the function of the cerebrospinal fluid, and if there is a leakages or if there is a overflow, so what are the hybrid aspects and how can it going to make the collections. So what is the use of to making the collections. So now we are going to be see in this objective parts. So here first of all we have to know about this one is a cerebrospinal fluid. So it will be just presented. Cerebrospinal fluid is a colorless liquid that fills in the ventricles of the brain and suborganized space that surrounds the brain of the spinal cord. So it has a many functions. It is occupy the suborganized space and to regulate the brain metabolisms. So these are the overview functions. Let me go to see the further slides. So what are the changes? Now we have to know about this one, where we exactly presented that there is a three connective tissue membranes external to the CNS. So what are the things? What is the first one is a dura mater, just mentioned here. There is a dura mater, and next one is a arachnoid matter, and another one is a, and inside there is a pia matter. So the cover. So what are the overall functions about the CSF? This we cover the protects the CNS central systems and protect the blood vessels to enclose venous sinuses, and we contain the cerebrospinal fluid and to make the partition within the skulls. So these are the overall function of the cerebrospinal fluid. And the cerebrospinal fluid is present in the suborganized space over the brain spinal cord in the ventricles of the brain in the central canal of the spinal cord. So this, I hope the picture will be clarify the, so where we exactly which is present and where it will be, just make the formations. So in the site as there is a and mechanism of the formations. There is a choroid plexus of the lateral, the third and fourth ventricles, and some amount of the secreted from the ependymal layer that lines in the ventricle. Again, I have to explain this one. CSF coronary cerebrospinal fluid is formed by the choroid plexus situated within the ventricles. Choroid plexus are the tuft of the capillary projection present inside the ventricles and are covered by the pia mater and ependymal covering. A large amount of the CSF is be formed from the lateral ventricles. So next we have to know what is on is the CSF is being formed by the process of secretion that involves an active transport mechanism. Formation of the cerebrospinal fluid does not involve any ultrafiltration or any dialysis. And data formations, how much it which is secreted, so is a 0.2 to 0.3 ml per minute. Amount of the cerebrospinal fluid 150 milliliter, and our hydrogen is a pH value is 7.3, and so we have as a maintain the pressures like as a blood pressure, just maintain the internal pressures with help of this one. In the cerebrospinal fluid we just maintain the pressure of there is a 120 to 130 millimeter of water that lateral lying the lying position. In sitting posture there is a 200 millimeter of water. Next, mechanism of absorption. The cerebrospinal fluid is mostly absorbed by the arachnoid or villi and into the dural sinuses and spinal veins. The small amount is absorbed along the perineural spaces into the cervical lymphatics. The mechanism of absorption is by filtration due to the pressure gradient between the hydrostatic pressure in the suborganized space fluid and the pressure that exists in the dural sinus bed. Choroidal substances pass slowly and crystalloids are absorbed rapidly. Normally, there is about 500 ml of CSF will be formed every day, that an equal amount of absorbed. So we just transfer towards the blood. And this is a important slide. So this is a circulation of cerebrospinal fluid. As a major quantity of the cerebrospinal fluid is formed in the lateral ventricles and enters the third ventricle by passing through the foramen monro, and from here it passes through the fourth ventricle with the help of this one addictus cilius from the fourth ventricles enter into the cisterna magna and cisterna lateralis through the foramen magendi and foramen lesca also. From cisterna magna and cisterna lateralis, CSF circulate through the subarachnoid space over the spinal cord and cerebral hemisphere, also known as it also flow into the cerebral central canal of the spinal cord. So here again I have to be explained as a maximum amount, which means a major quantity of the cerebrospinal fluid is formed in the lateral ventricle and is just a flow passing through by the foramen on road towards the third ventricle. From the third ventricle to fourth ventricle with the adductors sylvius helpful to just make passing through from third ventricle to fourth ventricle, and from fourth ventricle to spinal cord along with the help of this passing through passage of foramen magendi and foramen lesca helpful to just pass through the fourth ventricle to spinal cord. And from the spinal cord, the sub is going to just reach the subarachnoid space, and 80% comes towards the dural sinus and 20% in the spinal veins. And better have to show the video that we need to understand how can it's going to make the circulation of the cerebrospinal fluid. Yes. So it is initiated from the lateral ventricle, and with help of this foramen, a motor is going to reach the third ventricle, and followed by this is a fourth ventricle, and is going to be along with the foramen lesca and foramen magendi is going to just reach in the spinal cord. Okay. And followed by that we are going to see the function of the CSF, and it is acts as a lymph because there is no lymphatic system in the brain, so that's why it will be acting as a lymph and provide the proper chemical environment for optimal activity of the neuron, and useful for the diagnosis of brain disorders. It will be reflected the brain functions, and to protect the brain from the injury by acting the shock absorber. And next we are going to be acting as a protective of functions, and takes part in maintaining the constant internal volume of cranium, and contains formation of the drainage, helps to preventing accumulation of the metabolic products within the brain, provide the nutritional to the nerve cells. The cerebrospinal fluid is act as a fluid better buffer and protect the brain from the shock. Since there is a specific gravity of the brain, cerebrospinal fluid is a more or less the same. Our brain will be float in the cerebrospinal fluid. When head receives a blow, cerebrospinal fluid act like as a cushion and prevent the movement of brain against the skull bone, and thereby they prevent the damage of the brain. And here to be maintain the volume, to regulation of the cranial content volume is essential because the brain may be as affected if the volume of cranial content increases. It happens in cerebral hemorrhage and brain tumors, and increase in cranial content volume is prevented by the greater absorption of the cerebrospinal fluid to give space for the increasing the cranial content. Now we are coming to the end point as the applied aspects. Hydrocephalus is abnormal accumulation of the cerebrospinal fluid in the skull associated with the enlargement of head is called as a hydrocephalus. During the obstruction of any foramen through the which cerebrospinal fluid escapes the ventricular cavity dilates, and this condition is called as a internal hydrocephalus. It is also known as a non-communicating hydrocephalus. On the other hand, if the arachnoid villi are blocked, external or communicating hydrocephalus will be occur. So hydrocephalus, along with the increases intracranial pressure and causes the headache and vomiting in severe condition, it leads to atrophy of brain, mental weakness and convulsions. Now we are coming towards the collection of cerebrospinal fluid. Cerebrospinal fluid is collected either by the cisternal puncture or lumbar puncture. So here I just mention about the lumbar puncture. So lumbar puncture, the other is called the spinal tap. It will be just taken in between the L3 and L4. Okay. So that is a enter in the cisternal magna in lumbar puncture. The lumbar puncture needle is introduced into the subarachnoid space in lumbar region between the third and fourth lumbar spines. So posture of the body for lumbar puncture, the reclining the body is bent forward so as to reflex the vertebral column as far as possible. Then the body is brought near edge of the table. The highest point of the iliac crest is determined by the palpation. A line is drawn on the back of the subject by joining the highest point of the iliac crest of both sides, and opposite of the midplane this line crosses the fourth lumbar spine. So after determining the area of fourth lumbar spine, the third lumbar spine is palpated. The needle is introduced into the subarachnoid space by passing through the soft tissue space between the two spines. So what is the reason why we are going to be collecting or selecting this specific site in between the third and fourth lumbar spines? So the spinal cord will not be injured because it is terminated below the lower border of first lumbar vertebrae. So that is the reason the chorda equina may be damaged, but it will be regenerated. Subarachnoid space is wider in this site. It is because of the pia mater is reduced very much. So what are the uses? Yes, what are the uses? To relieve the pressure, to introduce the drugs, to introduce the anesthetic solutions. So collecting the positive diagnostic purpose, injection drugs, and measuring the pressures. Small amount of the cerebrospinal fluid must be removed slowly to relieve the intracranial pressure when it be raised, and clinically by injecting. And third thing is introduce the drugs, antibiotics as anti-immunoregent, and to introduce anesthetic solution is to relieve the pain in the labor. So in this situation they have to be just make the lumbar puncture. Yes, you have any doubt, you have any clarification, and then when you feel to free to ask, so there is no problem at all. So you can ask to any time, and followed by this one we'll get the MCQs. You have to fill the MCQs. So all the best. Have any clarification, just go through the book. Just any clarification, any doubts or any feedback also have to be text in the group. Thank you.